We're also joined by Caroline Timmons. Caroline's the Principal Officer in the Housing Policy Unit in the Department of Housing, Planning and Local Government. And thirdly, I'd like to welcome Aoife Flynn Kennedy. Aoife is the head of Clann, and Clann are an approved housing body. So thank you very much, everyone, and I will now hand you over to Patricia. And Patricia will commence with our first presentation of this session. Thank you.
Thank you, Tina. I'll just quickly share my screen. If other presenters could just give me a thumbs up that you can see my screen, that'd be great. All right, excellent. Well, thank you so much for that lovely introduction. My name is Patricia Gruits, and I am really excited and honored to be with you here today. I'm a senior principal at Mass Design Group, and what I'm hoping to do today is speak with you a bit and share some of our work. Mass Design Group is an interesting organization in that we are a nonprofit architecture organization. Our mission as an organization is to research, build, and advocate for design that promotes health, justice, and human dignity. We work around the globe. We have offices in Rwanda, in Boston, Massachusetts, here in the United States, as well as Poughkeepsie, New York, with a studio just started in Santa Fe, New Mexico, working with Native communities and Indigenous communities here. What makes us unique too is that we're structured as a collective. We bring together designers, engineers, architects, and researchers to tackle big public health and social justice issues in our communities. We were started 10 years ago, actually, with this project, the Bataro District Hospital located in East Africa, where the pressing public health and healthcare challenge there at the time was extremely drug-resistant tuberculosis. In existing hospitals, disease was spreading through poorly ventilated hallways and waiting rooms, and we saw the direct impact and effect that the built environment could have on making people sicker. At the time then, we asked if buildings could make people sicker, could they also make people better? Could architecture actually heal? Our organization has grown and evolved beyond just working in healthcare. We now work in education, public space, memorials, and housing. Always asking if we can design a built environment and built spaces that address the critical issues and promote healing. Our work in affordable housing in the US really begins with an understanding of how broken and harmful our housing system currently is. And I'm gonna be using the term affordable housing, which for me in the United States means that there's a specific housing typology that really is subsidized by the US government at the federal, local, and state level. It may actually be in Ireland more appropriate to call it social housing, but I'm gonna just let you know that that's the terminology I'll be using today. And what's important for us to share, what I wanted to share with you today is really the magnitude of the issue in the United States. Almost 40 million households are currently burdened by housing expenses. And this will include at any given year about 2.5 million people who experience a form of homelessness during the year. The question about how this will impact people, particularly during this pandemic, is going to be extreme. Certainly homeowners will experience housing insecurity and an inability to pay their mortgages, but renters in the United States are going to be the primary focus of our concern. If in 2018, before the pandemic hit, 50% of renters were already cost burdened, there's an incredible concern about what will happen in the coming months and the coming years. Many states on the right, you see this article which show the moratorium on evictions that have happened here, including in states like New York State and Massachusetts, where I'm based, where landlords are unable to evict people due to income challenges related to COVID. That may help, but in Boston, this reality is hitting people in different ways. Boston housing stock has multifamily units like the one you see here in the New York Times article, but we also have what is called a triple-decker unit, where homeowners actually live in one of the units and rent the other one or two out. If one of those renters, though, can't afford to pay their rent, it puts pressure on the homeowner and landlord who may not be able to pay their mortgage and potentially impacting a very critical aspect of our housing security. And this is all to say that we're experiencing a variety of different ways and are really just expecting an exacerbation of the housing crisis in the United States. Historically in the US, though, we do have a national initiative around affordable housing that seems to be fairly robust. However, unfortunately, we've already not been able to keep pace. In the US, while we are typically building 80,000 new units each year, It's estimated that about 100,000 units of affordable housing are lost each year due to gentrification or abandonment. So in some ways, we have a well-developed system, and in other ways, we are dramatically falling short. For example, in many places across Europe, and I'm not sure of the exact statistic in Ireland, I'm sure many of you do, but some countries have between 20% to 75% of their housing stock dedicated to social housing. In the US, all of our affordable housing, including public housing, supportive housing, any housing that is subsidized in any way, including housing vouchers, all amount to less than 5% of our total housing stock. So while we have this developed system, in a sense, it is much too small and not at all keeping pace with what the real need is. One of the critical challenges, obviously, is quantity of housing. That's what we're talking about. But as designers and architects, we're also concerned about the quality of housing. This is a diagram that we did to help us understand sort of the housing ecosystem that exists in the United States. And if we wanted to increase the quality of design, we not only need design excellence coming from our design teams and from our architects, but we needed developers who are able to steward the design vision. You see here in orange, the developer are really at the center of this diagram, having to navigate the political systems, the funding systems, the community and resident engagement. And it's really critical that cultivating and building capacity for developers to demand and uphold design excellence was going to be key to actually creating an impact in the housing sector. To assist developers through this, we started to create a framework that outlined a process to help them achieve good design. This process starts with identifying a project mission, a clear idea of what the project is trying to do and the impact it will have. We found that many developers thought the mission of their project was actually the number of units that were being built, but our prompt is to go beyond that. It needs to be a goal that's crafted by the community stakeholders and informed by the context in which the project sits. The mission is achieved through a series of design opportunities. We outlined 9 potential opportunities here, which can be identified and leveraged in the design of the project by developers. And all of this links back to impact metrics, measurable indicators and outcomes that prove the value and impact that good design can have. This process gives developers also the language to empower them to advocate for their projects and for the good design necessary to achieve their goals. One project where we applied this process is in a senior age-restricted affordable housing project here in Boston. Age-restricted for us means 65 years old and above. And this project was in partnership with the Boston Housing Authority and a nonprofit community developer called Two Life Communities. Two Life Communities' mission is to design housing for older adults. In Massachusetts, where this project is situated, the affordability of living is an acute need for seniors. And as senior population grows, which is expected to increase by 53% over the next 20 years, providing additional affordable units is a critical need. There is a movement in the United States to promote what is called aging in place, which aims to keep seniors living in their homes as long as possible. And Two Life's model, though, seeks to take this a step further to address issues of social isolation and loneliness that have been additionally identified as a public health issue for seniors. So not enough to just keep them in place, but how do we combat social isolation and loneliness? Two Life sees the opportunity here then is to not just think about aging in place, but really aging in community and creating spaces where seniors can fully live their lives in community to avoid isolation and provide a means to live better, longer, and together. Our question then became, how does design support that mission? How do we design for community for seniors? Given that this is affordable housing, we first looked at the most efficient way to build 150 units, which is what our task was. On the right, number 1, you see what the typical sort of approach would be, which would be a double loaded corridor, sort of bar-shaped building, a very efficient scheme. But the 150 units or even the 30 units that would be allocated per floor in the scheme were just too many people to meaningfully develop natural social interactions and social networks. So we worked with Two Life to understand what smaller grouping of units we could create to create what we call a cluster that would break down the scale of housing and create more meaningful interaction between residents. So once we sort of broke down those schemes into clusters, we reduced the corridor length, trying to, again, bring more people together in the same shared space. We then connected through a central corridor length, really creating moments along that corridor for lounging. We then moved and adapted these clusters to create a diversity of spaces between them and connection points to create access to green space, views, and natural light. And lastly, along those areas, created destinations, meaningful spaces for programming, such as living rooms, dining rooms, fitness, and laundry areas to help bring people then back together. This is how the plan of those upper units and residents evolved from what I showed you as a diagram, or really the goal of the project, into reality in the plan. You can see that the residential clusters are then connected to this sort of, residential units in purple are then connected into this yellow sort of community space running through the center of the scheme. This is sort of the inverse of that image, showing how that central spine is really activated and how different program areas are defined through design, connecting spaces like a gallery and exercise rooms to a library and so forth. The lower level of the project is entirely a semi-public space. There was a collaboration with a health center that's dedicated to the elderly alongside an adult daycare center where residents and non-residents could come and spend their day and receive critical care. There's also in yellow here highlighted all of the community and resident programs, which are on the street level facing the outdoor plaza, as well as in pink, a commercial zone as well. Access to nature was extremely important in this project, and in age-restricted housing where everyone is over the age of 65 and of similar demographic and age group, we felt it was important for communities to be diverse and intergenerational interaction as critical for people to thrive. So we looked to create an intergenerational play area for residents, their families who might be visiting, as well as people living in the surrounding neighborhood, all to come together. This is an image of that intergenerational play area as the project evolved. You can see how it sort of nestles and pulls people in off of the street. The ground floor, which is activated by this public plaza and commercial zones. And lastly, the front edge and entry and main entry into this space, where you can see the different materials coming together, that original diagram calling out what is community space here in terracotta shingle, and then the resident units and blocks in a different material above. Now, as we were nearing the end of completing construction documents on that project this spring, COVID hit. And this idea of social interaction for seniors seemed to be directly at odds with the recommendations for social isolation. And as I mentioned at the beginning of my talk at Mass Design Group, we were founded really, in response to epidemic disease. As I mentioned, the Bataro District Hospital, which is this image on the left, it was extremely drug-resistant tuberculosis. And we have since partnered with organizations around the globe who are on the front lines of the world's major health challenges, from the cholera epidemic in Haiti, which is the image in the center, to the Ebola epidemic in Liberia, image on the right. And this is where we were able to design and build spaces for care. This spring, as COVID-19 spread throughout the United States and throughout the world, others on our team were asked to help our partners in the healthcare sector by providing guidance on best practices for infection control to meet these urgent needs for our communities. Initially, we partnered with social service providers here in Boston to prepare for COVID outbreaks and create safe and healthy emergency pop-up clinics. We then partnered with Mount Sinai Hospital in New York to assist them in adapting existing healthcare spaces to clearly identify and mark what is considered clean and dirty spaces to protect that blurred line for patients and for their caregivers and doctors and nurses who serve them. We collected these lessons into a set of resources for others to learn from and build upon their own projects. These are a series of resources that are available and free for download on our website. They're also currently updated as we learn more about this pandemic and about how the disease is spread. But one thing that COVID really has taught us is that we need to think about health and wellness outside of the typical healthcare spaces and design for better infection control throughout our communities, in our schools, in our restaurants, And as we all spend more time in our homes, our housing as well. As I mentioned, as we had been completing the design of that senior affordable housing project, we understood that there were these tensions in the field of senior housing design anyway. This tension between providing control for residents and control for operators, but also agency and autonomy for residents. We had to battle or sort of understand the tension between flexibility and specificity of senior needs, between designing an institution and designing a home, and really questioning how do we design for social isolation and community. And so this became an opportunity for us to challenge ourselves, not only to apply evidence-based design principles to our healthcare projects, but to housing. The process of creating this guide really started with a series of conversations. It started from some of the projects that we were actively working on, but it also started with us connecting to our broader network. So we started by sharing our ideas and listening to partners, bringing together developers, architects, housing operators, and funders who were all asking the same questions. We know seniors are at greater risk. We also know that social isolation is a threat. So how do we actually balance infection control and social interaction? This is the completed guide. It's open source and available on our website. And the guide frames the issue, explains our methodology, articulates design principles and guidelines, and applies them to a case study project. I'm going to share a few of the lessons and sort of learnings from the guide with you today. First, we synthesized these conversations and best practices into 8 design principles for infection control. The first was to really look at how we could make spaces breathe better. Emerging research is still showing that COVID-19 is transmitted through airborne particles, so it's essential for proper quantities of fresh air to be delivered to residents. Evaluating and maintaining HVAC systems, but also looking for ways to supplement air dilution with operable openings. We also were learning through our healthcare work about the sequencing of flows through a space. Simply leveraging wayfinding, signage, creating spatial literacy where people understand where they are in a space, spaces that are clean, spaces that are dirty, and also directing residents and service providers and visitors so that there's not unnecessary mixing. We also look to reduce pressure on high traffic places. Social distancing recommendations need to consider those with mobility issues. Elevators, hallways, and shared amenities and other high touch, high traffic areas pose a greater risk. And so creating needs for additional seating and hallways to allow residents to safely pass each other or designating spaces for queuing was essential. We also looked to group residents into villages, creating small adjacent spaces or clusters of units that can offer interaction with a controlled set of residents who may share some of the same amenities without having to rely on potentially higher risk areas such as large shared multi-purpose rooms or dining spaces. We also looked at expanding the threshold of the unit, threshold meaning that entry and exit from the corridor to the unit itself. As more foods and services are brought to the doorstep, the unit or house entry must adapt to spatial and behavioral needs. Signage, clear to reduce delivery mistakes, but also designating space and off the floor for packages and deliveries to keep circulation clear and reduce tripping and fall hazards. We also want to encourage people to get outdoors. The risk of infection is lower in open air, and increasing the quantity and quality and accessibility of outdoor spaces, as well as creating a diversity of them through scale and program is essential. Obviously, increasing cleaning protocols for high-touch surfaces, it not only improves safety, but it also increases comfort levels and trust. And providing an awareness of high-touch services with brightly colored paint or tape and signage can also increase people's comfortability. And lastly, embedding technology. Communications technology not only allows for critical information to be shared immediately, but many are using it to conduct wellness checks and reduce isolation in that way as well. And standardizing this technology creates an equitable access to communication and reduces burden on resident staff and service staff to have to work within multiple systems. So one of the challenges that we were having, we had created these principles, but one of the challenges we were having in adapting these principles into a guideline for housing is that it's really challenging to fully grasp all the different variations of housing and care types that exist for seniors, and the different levels of risk that exist within them. In our healthcare work, we were able to code or color floor plans with clinicians to understand which spaces were dirty or had high risk of contagion, for example, a patient room, versus clean spaces, which would have a lower risk, for example, like a staff lounge. This distinction we found to be just a bit more challenging in housing. In housing, all homes encompass a private and a public realm. For those practicing social isolation and social distancing, it's been typically understood that where there are more people or where there's public areas, there's a greater risk of contagion, or spaces where there are fewer people or private areas, there's less risk. Our team, however, tried to understand this in a more nuanced way, seeing not just public or private, but really a spectrum of experiences between them, including semi-public and semi-private spaces that really change based on the resident's living and care situation, and may ultimately be spaces where greater social interaction can actually occur. So for the purposes of this guideline, we defined public to sometimes mean sort of the curb or entry into the public domain. Our assumption is that in these spaces, an individual or resident has minimal control over the infection measures and relies really on others, on the government, on policymakers, on the operator, et cetera, to establish the infection control norms. In the semi-public space, thinking of these as the lobby or shared amenities, we understand that typically a shared agreement for behavioral norms may exist, but the quantity of people and proximity really to the public zone might make it difficult for an individual resident to enforce or have control over their situation. In the semi-public space, really we see these as like shared circulation or really resident dedicated social spaces, can really be defined more by their scale, as they typically limit the number of individuals who use a single space. And users of a shared space are usually known, giving individuals greater control and knowledge of potential risks. And then those private areas we really see as the unit interiors, where individuals have the greatest amount of control and where risks are the lowest. We also realized that this isn't a one-size-fits-all situation. So the guide introduces prompts to help residents, property managers, and visitors determine where each threshold lies and key factors to be aware of to maintain infection control. One person's threshold between clean and dirty may actually exist between the public and semi-public realm, whereas another person's situation may actually put that clean and dirty barrier, that threshold, really up against their unit or the front door of their unit. And so we decided that we would test these design principles and framing of these thresholds within a case study. So we selected a generic multifamily affordable housing project for older adults. The sample building for us, we determined that it would be multi-storied with a double loaded corridor because they're very common and be located in the eastern United States. Additionally, we created some parameters for the housing to help us test the recommendations, and we assumed basic services are provided to residents, but most care is delivered through home health aides or vendors, which you can see here in this image, how different stakeholders in the process have different access to these different thresholds. We then broke the study down along the public and private spectrum and looked to adapt the building design to address each of the principles we had laid out. Some of the strategies, all the strategies are highlighted in the guide. I'll just share a few of them highlighted here today. So in the public realm, some of the things that we would look for as we apply these principles is really to create a buffer zone between the entry of the building and the curb. Here we're suggesting to use design cues as a way to shape behavior, create an opportunity to establish clear wayfinding, announce infection control guidelines, and reinforce how to help those unfamiliar with the building. In the semi-public realm, looking for ways that we could adapt spaces to allow more people to come together safely, creating queuing spaces as well as directionality, where possible expanding the semi-public realm through co-locating basic amenities, such as a grocery store or a health center or pharmacy. Really creates opportunities for residents to have greater range of their needs met within the building or within the campus footprint, and also gain back some autonomy without leaving the building. For the semi-private realm, we look at the floor of the building, looking for opportunities to transform underutilized areas, storage areas, additional circulation spaces, or even opening up units to embed programming so that it's not just on the ground floor level, but on upper levels closer to the housing units and breaking down the relentless corridors into clusters of neighborhoods. And lastly, in the private realm, again, expanding that threshold to each unit on the shared hallway side, creating shelves, hooks for deliveries at an accessible height and off the floor, and creating spaces to accommodate the donning and doffing of PPE. Converting balconies, which allow residents to open their units more broadly to fresh air and interact and socialize with neighbors at a safe distance, and also embedding technology in the base design of the unit for contact-free connection. In conclusion, there's a few things that designing for interaction and infection control taught us, which is that they aren't always at odds. Fundamentals like smaller scales of pods or clusters, work well in both conditions. Co-locating programs or multi-use developments allow residents to access more services on site at all times. We also learned that simple design solutions really could be leveraged to have a huge impact. The balcony, which has been seen as sort of a design hero throughout the pandemic, is seen in affordable housing as a luxury. And COVID-19 is making us see access to open air and outdoors and even balconies, not as a luxury, but as essential. And another main thing that we're finding through this work is that good design for infection control also creates healthier design for communities, not just in senior housing, but in all spaces we inhabit. So this is just the beginning of our dialogue and understanding of the impact of COVID-19 into this space, and look forward to furthering a conversation with you all about how we achieve healthier design for everyone. Thank you.
Patricia, thank you very, very much for that. It's very, very interesting, thought-provoking, and I could see that in setting out a pathway for all of our future designs for multi-purpose needs in residential accommodation. If everyone could be thinking of sort of questions that they want to pose to the panelists now and upload those onto the Q&A. We will move on to our second speaker today, Caroline Timmons, who's the Principal Officer with the Housing Policy Unit in the Department of Housing. Caroline, you're welcome, and if you are ready to go, if you can unmute and commence. Thank you.
Yeah, I'm going to begin just by sharing my screen. And hopefully that's working there now. Similarly, can I ask for a thumbs up, please, if you can see the screen? Great, thank you. Okay, so just to begin maybe by just saying how interesting that presentation was there. I think probably Patricia has kind of pointed towards the US situation very broadly and then brought it down to housing for older people, which would be more my specific interest. Just to say, I'm a Principal Officer with the Department of Housing, Local Government and Heritage, and as part of my brief, I and my team would deal with housing for older people. And I'll maybe take you through some of the stakeholders in that area, just for anybody who hasn't come across this particularly before. But firstly, maybe to dwell on some of the original points that Patricia made, which was, I suppose, it was registering me a lot of the similarities between, I suppose, the situation she described and we would find ourselves in. She talked about housing and the situation regarding affordability, and of course that definitely is a high degree of residence for all of us, where we're experiencing severe affordability challenges in the Irish housing situation. She talked about housing cost burden. Now, we would be different in that respect. Our housing cost overburden rate is actually relatively good due to the high level of home ownership we have in this country. We'd actually have one of the better rates in Europe. However, like she signals, for renters, the housing cost overburden rate would be much worse. And for us, that would be about the same. While it isn't the same percentage as she indicated, we'd be about 19% of having a housing cost overburden in the rental sector. It is a similar kind of construction of the sectors. And she spoke about, I suppose, her affordable housing probably being our social housing, and that's fair enough. Our social housing is based on I suppose, potentially a kind of system that works differently to others, and that's income-based instead of cost-based. And so I'm not sure of the similarities. I'd be interested in hearing more about that potentially. But she talked about having less than 5%, whereas we're running at about 9–10% at this stage. Although ours is still lower than it was in the past, and it's lower than some other European countries and higher than others. I suppose maybe just to come on to describe where we're at in terms of policy in relation to housing for our ageing population in Ireland. I'll just briefly reference our own policy statement, which is a joint policy statement with the Department of Health. And I suppose one of the key realizations that has come to pass in the last few years in this area is that you can't do this alone, that it's a partnership with colleagues in the Department of Health, and understanding, I suppose, the various stakeholders that need to act in the areas and who need to collaborate to make this work for older people. So we did publish that policy statement in February 2019, and it's a framework, and it's how the government can facilitate and promote a variety of housing options, including housing with care or with supported housing of the type that Patricia has mentioned for older people. Interesting in that respect is, I suppose, some of the findings in that policy document is the amount of older people we're going to have is going to seriously increase over the next while. Our demographics would show that we'll have a massive increase in the percentage of older people. I think it'll rise by a third in the next 8 years. It'll rise probably even potentially get to 1.4 million by 2040. So we're expecting to have a population over 65 that has vastly increased, and that brings about a load of different economic issues to bear, not least in the pension sector. But for housing, that is an issue, and it causes various types of problems. But one of the things that we're trying to address is, firstly, what do older people want? What do we need to provide? What are the models we should be looking at? And then how do we as a state support the bringing about of those models, both in the private, social, and possibly the emerging affordable sector? So when the department started looking at this, they used these 6 principles for housing for an ageing population. So we looked at aging in place, supporting urban renewal, promoting sustainable lifetime housing, assistive technology, staying socially connected and working together. And there's a lot of similarity in that with what Patricia was describing there, the design elements. They're definitely very similar, and I think probably we're all coming to a very similar realization about what we want and what we need. I suppose within that, considering what did older people want, they were very much about aging in place, and for the vast majority, they want to age in their own home, and that is very much to the fore of our thinking, that where we can, ourselves and the Department of Health and our partners in the health services should facilitate that. That's very, very key. If you want to stay in your own home, you should be allowed to. However, a lot of, or at least up to 15%, would potentially indicate that if they could at least age in their own community, that would be important. So for supported housing for the area Patricia's talking about, I think that that's very key, that we find a way to keep them in their own community so you don't lose the connection to church, the shop, the local community, the people who have been around you for your whole life, and we don't uproot people. So that's going to be key to the thinking going forward. So in relation to the policy statements, we're not about imposing solutions, but we've asked and we've listened, and we're keeping doing that because we keep working with stakeholders. So what makes sense for older people? We've put an implementation group in place. There's 40 actions in the policy, and I decided it wasn't going to be worth your time taking through them all, but you can have a look at those yourself. But they do involve kind of doing a bit more data gathering, a bit more research, checking out the policy options, making sure that our demonstrator projects are underway and keeping those going. We work with a lot of different partners on that. The Department of Housing works with the Department of Health, but we also work with HC. We work with our own housing agency, who do very important work in this area. We work with Age Friendly Ireland, and we work with all the various AHBs in the area. This is kind of a diagram of how it's working at the minute. That I'm sure will evolve over time as this area of policy evolves. But at the moment, there's department-led actions, but they're all chaired through that implementation group. You have subgroups coming out of the implementation groups. I hate a proliferation of subgroups, but they do allow us to expand the memberships of the groups. So there'll be, I suppose, more than 20 on the implementation group, but in each subgroup, then we can invite people with the expertise needed. You know, if you need someone on design like Patricia, or if you need other people from AHBs or from Alone, you'll ask them to come in and assist us on the subgroups who are dealing with various subsets of the 40 objectives. We've had a good bit of progress to date. Like everybody, we found that COVID has been a bit of an issue, but I suppose one of the better aspects of COVID is allowing us to all get together like this a bit more often. For many people, actually, meeting online is proving, I suppose, more convenient. So we have now effectively got back up and running. The second report at that implementation group will be published shortly, and indeed we've agreed to extend the term of the implementation group to allow us to get our work done One of the aspects of the work that we're doing, I thought would be worth mentioning today, is that together with the Housing Agency, Department of Health and Age Friendly Ireland, a subgroup has been working on a new website, which is going to be called Age Friendly Homes, because we felt we needed a blueprint, and that's very clearly signalled as one of the chief actions in the policy. And when we were thinking about, well, what's a blueprint? It's exactly what Patricia was describing. How do you let a developer know what to do if they want to get into this area, if they want to provide? How do you tell local authorities? How do you show what good design is? Where is the repository for all of this? And how do you create that space for conversation around this? So our colleagues in the Housing Agency actually had seen examples of that from Housing Lane in the UK and were advising us that this was a good way to go. And they're making very good headway with consultation with Housing Lane as to how we might put this together. And we're hoping to have that launched either very late this year or at the start of next year. So I think that that will be, I suppose, with things like the guide Patricia was describing, that's exactly where you might put that. So everyone will know where to go to actually get all of the expertise in one place and to see good examples of projects. If you have a look back at our own policy, you'll see examples of some very good projects that for older people that you can take a lot of inspiration from. And I think one in particular would be the St. Michael's demonstrator project, which we are involved with again, with health, with the HSE, with Circle, BHA and Loan. And that's a housing with supports demonstrator where there's a beginning project with, I think it's 52 units for older people. That would be very interesting. It's going to provide a lot of learning for us as to how we might do this project. And the design of it actually wasn't that dissimilar to what I think Patricia might approve of actually, if we gave it to her. It thinks a lot about the principles that Patricia was advocating. It hasn't got the COVID added piece that Patricia was able to describe today. So I'm interested in maybe seeing how do we bring what Patricia was talking about there to bear on that particular development. I'd say we'll take that back maybe to the Chair, Maurice O'Connell, on that and just see how we incorporate it, or can we still incorporate, because that's gone through planning, but it's yet to get up off the ground and should do very shortly. So I suppose just to maybe indicate from a policy point of view, if I had, we'll have a couple of questions. I'll let everybody else get in first, but I suppose we're always thinking about costs. So I'd be interested to see if the panelists have other contributions they can make on the cost of this type of design, on the principles of universal design, whether it's the same in America or not. And for us, just to say that it's a very interesting presentation. I look forward to hearing what Aoife is going to bring on that as well. And I'll come back to the questions later and let everybody else get in. Is that all right? Thanks very much, Tina, and thanks.
Okay, Caroline, thank you very much and for getting in early with those questions. I see Patricia has quite a few questions lining up for her, and hopefully we'll get to those after we finish with Aoife Flynn Kennedy's presentation. Aoife, who's the head of Clann, an approved housing body. Aoife, if you're okay to commence with your presentation.
Hello, everybody. I'm just going to share my screen here. And I'm hoping that's showing for everybody. Okay. Brilliant. So I'm delighted to be here to tell everybody a little bit about Clann. Really interesting listening to both Patricia and Caroline. I'm hoping in many ways that what we're doing in Clann might show the practical application in Ireland of some of the issues that you have raised. In particular, the impact that the environment can have on a person's well-being. And we're definitely seeing that among our residents. And there's a very, very strong focus on aging in place, which Caroline and Patricia both referenced. So I'm hoping that you will see that come through as well. So Clann itself, it's a dedicated age-friendly housing provider. So we're aiming to meet the needs of people over the age of 55. The word clan was chosen by our residents. It's the Irish word for family, or a group of people with a common interest. We've a team of frontline scheme managers providing an exceptional service to our residents, and we've about 700 homes currently in management. Our vision is a society where everyone has a great place to live. Clann has been developed out of Clúid Housing. Clúid conducted a piece of research in 2015, and from that piece of research it was decided that a dedicated age-friendly housing service should be established, and Clann officially launched in February of this year. So everything we do in Clann is about our residents. We really believe in empowering our residents to live independently for as long as possible in their own homes. And they're at the heart of everything we do. They actually even designed our logo, the purple square there, which is kind of an unusual shape representing the different types of homes, because all our homes are built to fit in with the environment that they're built in. So we have apartments, we have bungalows, tying in with where they're actually located, and then the inner square there representing the residents themselves, and again chosen by the residents to represent their uniqueness and the fact that they're all different. So what do we offer in Clann? We have a dedicated scheme manager, and all the images you see throughout this presentation are actually of our residents themselves and our scheme managers. So we have a dedicated scheme manager that's attached to every site. We aren't a provider of care, we're a provider of independent living, but our scheme managers assist residents to access supports that are in the community already, and help them to navigate the way to get those supports. We have a customer contact center that all our residents can contact to report repairs or answer queries or any issues that they may have. We've our own dedicated repair service, so we access the service of Fluid Works. So that's a big feature for our residents, knowing the repair staff that are coming into their homes, and having that familiarity and that trust with them is hugely important to them. We've a 24-hour emergency response service. So in all of our Clann homes, we are partnered with Tunstall. So all of our residents have a pull cord within their homes that they can use. They can also choose not to use, and that's their choice. They can also access a daily well-being call if that's something that they want as well, or reminder calls in terms of medication, or anything that allows them to live their lives independently in their own homes. And then we put a big focus on community and location. That's a lot of our Clann schemes. That's what it's about. A lot of our residents want to remain living in their own homes, in their own communities. They want to be somewhere where they can easily access shops and other services, as Caroline mentioned, staying connected to your own community. So we spend a lot of time with our new business team really looking at the locations of our Clann schemes. And if it's not going to meet those needs, then we choose not to go with a Clann scheme in that location. So currently we are in the following locations. We're not in every county yet. Hopefully there will be the option of a Clann offering in every county eventually. We've 700 homes all across the country at the moment. And as I said, all of them are built close to local amenities and shops. So why have we focused on age-friendly housing? Caroline referenced really a lot of the reasons why we have done this. Our population is aging and aging dramatically. It's probably an area that we haven't had enough focus of in the past. And obviously when it comes to housing, there's always a lot of competing demands for housing. We want to maximize the delivery of new age-friendly housing to meet that demand and close the gap in service provision between housing for older people and nursing home accommodation. And have an offering of Clann as a suite of housing options for people. And we want to meet the needs of Ireland's ageing population. So aging in place, so two of the really core principles of what we look at when we're designing homes for Clann is both aging in place and universal design. So aging in place, as referenced by both Patricia and Caroline, it allows us to meet diverse and complex needs. It costs less. Our research showed that it's about 1/10 of the cost of nursing home care. And when you think of the amount of individuals in Ireland who maybe don't have the choice but to avail of nursing home care, you can see the massive savings that would be there if there was another option for people. It's more comfortable. There obviously is no place like home. And it strengthens social networks and fights isolation. It really strengthens self-determination. So having that control over your own environment, who comes in out of your home, and having that choice about that, and it promotes self-worth. There's a big focus on staying connected to your community and being a part of your community and having really meaningful roles, not tokenistic roles. Our residents are really contributing to the communities that they live in, and they really value being able to do that. Universal design then, so greater independence for residents. The environment, as Patricia outlined, really has an impact on whether or not you can remain living independently. And we build our homes with the principles of universal design so that people can really stay living in their own homes for as long as they want to. It also eliminates the needs for retrofitting and adaptation costs and reduces the cost of capital works in terms of disability grants. We have found that there is less need for support services when people can get around their own home and their own environment with ease, and residents can remain in their home longer. So we have residents coming into our homes at the age of 55, and currently our oldest resident is 95. So those individuals at the kind of the later stage, the 80s and 90s, are still engaged with their community, they're still engaged with their family, they're still playing a really important part in the wider community, and that's because they are able to live in their own homes. So we're definitely on a journey. We've 700, as I said, homes at the moment, about 20 staff and about 21 schemes. So we've a real solid base for moving forward. But there is a huge demand for age-friendly housing in Ireland. And I think that demand, as Caroline referenced earlier on, is just going to continue to grow. So at the moment, we have 800 new homes in the pipeline, and we'll have them in place by the end of 2022. We've a big focus on opportunities to right size at the right time. So very much led by the residents or the potential residents, that they have a choice of when they can right size. What we want to do is become the preferred housing option, a housing choice for people over the age of 55. That's our ultimate aim. And we're also exploring options for affordable rent. We're doing a lot of talking to different groups that are in the age-friendly or the old person sector at the moment. And what we're coming across time and time again is individuals who are asset rich but cash poor, who have very big homes that they can no longer manage, but very little income. And they're really looking for an option to downsize, but to remain in the community that all their friends and their networks and their contacts are all in. Obviously, this doesn't happen on your own, and we've been really lucky to work with some amazing partners who have actually made this a reality for us and given us the opportunity, I suppose, to have this service offering open to people. So Clann, very much in its infancy, growing rapidly fast, and I think that's really just a reflection of the need for a service of this type, this offering, among other suites of service offering for older people that is needed in Ireland at the moment. So thank you very much, Tina. No.
I'm not sure, we might have lost Tina.
That's okay.
Aoife, thank you very much for your presentation. That was excellent and again thought-provoking. And being a national provider of accommodation for older people, especially. Hello?
We can hear you.
We can hear you, Tina.
Hello, can you hear me?
Yeah, we can indeed.
Okay. Thank you very much, Aoife. Thank you for your presentation. That was excellent, and it's good to hear that we have a national provider concentrating on accommodation for older people throughout Ireland. A number of questions coming in, and I'm happy to open the floor. There's a number around wheelchair accessibility, which are addressed to Patricia. And perhaps if Tony Cunningham, would you like to activate your microphone and we can get you onto a video link? if you would like to put your question directly to Patricia. Hello.
Yes.
Hi.
Hello.
Is that Tony?
Yes, how you doing?
Hi, Tony. Hi, Tony. Thank you very much for your question. You're very welcome. If you would like to put your question directly to Patricia, I'm sure she'll be happy to address that.
I will indeed. I suppose the first one really, well, I work with the Irish Wheelchair Association, so we specialise in wheelchair accessible housing, obviously for people with disabilities. It's one of the smallest part of the organisation, and the main part is providing support services to people in their homes and the communities. So in relation to the housing, I suppose the ongoing challenge for us here in Ireland and for our members is the lack of wheelchair accessible housing. I suppose in every part of the country really, and it's an ongoing campaign to, I suppose, try and improve the supply ultimately, but also the actual design specification for the wheelchair accessible housing. Our building regulations don't provide adequately for what our members need, and that's older people and younger people of all ages. So I suppose my question is, how do you address that in the States, and what actual design do you use? That would be my first question.
Sure. So every project in the United States has to adhere to the American Disabilities Act guidelines, ADA for short, and that's required of all of our housing. That has guidelines not just for wheelchair accessibility, but for other dimensional requirements that we need to adhere to. Additionally, in the United States, and I don't, to apply for some funding, especially some federal and state funding, there's what's called a Qualified Allocation Plan, QAP for short, that outlines additional design requirements, both in terms of square footages, dimensions, counter space, counter height, et cetera, that all start to cover and require certain amounts of, accommodation for different types of abilities. So those are the two sort of resources that we have to design towards. I would also say in some of our partnerships and some of our learning, a lot of the sort of trends in design, I think, as Clann is putting out as well, is the adaptability over time for someone to be able to come into their home, really having minimal barriers and minimal thresholds, all like to begin with, and then to be able to adapt the counter height or to adapt easily the sink height, or to have certain grab bars and the blocking already in place for when mobility becomes more impaired, which allows someone to move into potentially a new home, an affordable unit, earlier in their, when they're younger, and be able to have that same unit adapt to their needs as they evolve.
Right. I suppose the second part to my question that's linked to that actually, and it's around, I suppose, the planning for supply. You could, well, say worst case scenario, you build 100 apartments in Castlebar, where I'm based in Mayo, and none of them are designed to a wheelchair accessible standard, because there's no one immediately on the waiting list for that area. What do you do in terms of sustainable communities, and like, is there a percentage that has to be designed in the core structure for to give that space? Because circulation space obviously is the biggest challenge for people who use wheelchairs.
Yeah, I mean that's part of what we have to design in of every new project that comes online. It's a certain criteria, which does have some impacts on thinking about elevator accessibility, cost of elevators, how you kind of allow people to be able to circulate, not just rely on stairs. A lot of the movement, actually the project that I shared with you, JJ Carroll, the Senior Affordable Housing Project, actually is replacing affordable units that are duplexes that only are accessible by stairs. But those stairs essentially have created a number of shut-ins in the current housing scheme. It was built back in the 1960s. And so basically they've become obsolete, because to retrofit them to meet standards and actually provide quality housing for seniors, we're replacing them entirely.
So does a percentage of the developments have to be designed?
All of the developments have to adhere to ADA, and then there's an additional percentage that's based on whatever funding stream you're accessing specifically. So to get funding approval, there's certain requirements you have to meet.
Okay, must inquire more about that. Yeah, I'd be interested to hear more. But I'm conscious of taking time on the call now.
No,
So,
thank you. That's a great question. Really
yeah,
interesting challenge as well.
might touch base at another time. That'd be
Yeah,
great.
happy to.
Thank you.
Thank you.
Tony, thank you very much for your question. And it sort of wraps up. There was a few questions there relating to wheelchair accessibility in design, and that hopefully will answer a number of those questions. Can I ask Aisling Flynn? Aisling, would you like to come online? Thank you, Tony. Aisling, would you like to come online with your question? Who you don't necessarily say who it's directed to, but Aisling's question is about people's abilities diminishing over time, and how do we, as a sector, enable them to continue to live in their own home? Aoife, would you like to pick up on that one, perhaps?
Yeah, absolutely.
We have Aisling on. Sorry, maybe if she wants to. Aisling, if you would like to ask directly, if we can, yeah, there we go. Can you unmute, Aisling?
Hi, can you hear me? Hello?
Yeah, we can hear you, yeah.
Can you hear me? I kind of forget my questions now because I've asked so many, but I suppose my first one was, I was just interested, I found Patricia's presentation fascinating. I suppose what did occur to me when she was going through all of the measures and strategies around addressing spaces and infection control and all of that, it did occur to me that it seems to become, very rule-based. There's, when you're admitting a visitor, there's a certain protocol and, strategies you have to go through it. When you're collecting your mail, it's the same. And I suppose it occurred, like, how do you mitigate against that people are not living, in an environment that's just all about rules? You can only go in a certain door, you can only admit a visitor in a certain way, and so on. I was just kind of interested how you manage that.
Yeah, I think it's a really great question, and I think something we struggled with, because as you're trying to create safety measures and balance social interaction, we want to create those moments of sort of casual engagement with others, make people feel really comfortable and safe. And so some of the rules are there, I think, to build that trust so that people feel safe being in those spaces, interacting with others, because everyone is following the same general sort of infection control measures and guidelines, as well as providing adequate spaces where those interactions might be able to happen out of doors or in really well ventilated areas is another way to sort of think about where those interactions can happen. As we talked about thresholds, I mean, I think, depending on where the entry to the building or the unit is, depending on where the mail is collected, is, a question between, is that in the public realm or is that closer to the private realm? And what we've been testing or thinking about is this idea of pods, and how having the same number of people that you might casually interact with at a smaller scale, rather than maybe 150 people all sharing the same mailbox or the same common space, if you can break it down to where that interaction can happen with the same set of 10 individuals, outside of maybe, their units more productively, or programs are run for those 8 individuals. It's something that we're seeing here with some of our primary age students, in education, and how can we borrow from what we're learning to be successful about how people are able to sort of interact in schools and interact outside of schools and create their own kind of meaningful pods. And does that allow for that same interaction, but just at a smaller, in a more controlled way?
Okay.
But yes, it is the essential challenge. Right,
Yeah.
how not to make it all rules-based and very rigorous while still allowing for interaction.
And I know that this is very new territory for all of us, and we're having to live by rules, and we don't like rules. We don't like to have our expression or our movement, curtailed or limited. But I suppose this is just leading on. My other question, it was around design as well, and I suppose it's open to everybody. it was, we work with, we're an AHB that works specifically with people with intellectual disabilities who live in their own homes in the community. But a lot of those are older people as well. In fact, a significant number of them, so that we have a number of challenges that we have to address there in housing and accommodation provision. I suppose a more general question, I mean, how do you, deal with design issues in terms of, adaptability, where, as the person gets older and their cognitive, ability might diminish, so that they can still continue to live in their own homes. I suppose that's kind of for Patricia, but also for others as well.
I can start, and anyone else can jump in. I would say part of our approach is to look at evidence-based design, where we can actually point to specific measures that can be embedded into the base design so that everyone benefits. For example, some of the kind of research is showing that people with early cognitive issues really struggle with high contrast, or areas that like where there's like a black frame, for example. When they start to lose that visibility, it looks just like a black hole, which can be very scary and fearful. And so we avoid, just in terms of the design and the colors we choose and the signage, avoid certain types of color strategies and color schemes to ensure that everyone benefits and that you can age safely and allow your so that you can stay in that housing as long as you possibly can. But also say there's, strategies around kind of knowing where you are in space. That's one of the things that happens most frequently in people who have that cognitive decline, is getting confused and not knowing where you are. So creating either loops within the building where someone might, circle back, whether it's a courtyard building or something that allows them to sort of circle back to the same place to find out where they're going, or creating distinct sort of views even to the outdoors, that I can see where I am, not just in the building, but where I am on the street. And additionally, being able to like see around a corner has been something that we've thought about in the project that I showed this afternoon, with that sort of long sort of community space. At each way that those clusters connect to that community space, there's a direct line of sight directly out to the outdoors. So as you come out of that corridor, even though they might feel very similar, you're seeing a different view, not just of the interior of the building, but of the street, of the back courtyard, the different courtyard that is like a meditative garden. So trying to give people different visual cues has also been seen to be helpful. So we try to embed those kinds of principles really early on in the design, not as something that's additive, but something that's fundamental, because it's just better design for everyone.
Okay, great.
Does that answer your questions, Ashley?
No, it does. Yeah, I suppose just this is just a quick question, really. The last one was related to funding, and this probably just directed at Aoife and Tina in particular. Just primarily, what kind of funding do you access? Is it CAS funding? And just, I suppose, just what rent supports are generally available for your tenants? What's your experience of that been? And then that's it. That's me done then. So I promise.
I can give you a quick answer from my perspective, and then hand over to Aoife. In the main, our funding is through CAF and P&A, and the tenants would pay the differential rent.
Okay.
And that's what we've found most, I suppose, easy to deliver in terms of getting the design right and being able to meet with all the quality criteria design. Maybe if Aoife would like to answer that, and I'm just lining up if maybe Anne Carney's on the set there, that I'll go to Anne next for her question, which is more of a policy question, and we could probably direct that towards Caroline. Sorry, Aoife, would you just like to answer?
Yeah, no problem. I suppose just two responses really, Aisling. One in relation to the last question that Patricia answered. We use a lot of what Patricia was discussing there in terms of colour design and layout of the building, and that idea of, as Patricia outlined, being able to know where you are when you're in the building by the landscape that's outside it. We do a lot of work with people moving from congregated settings as well. So we would be doing a lot of kind of assessments of the individual and the individual specific needs. And then the universal design really helps that, because the building is, the fabric of the building is built in such a way that it's so easy to adapt it then for the individual and their own needs. So just that comment on that piece. Similar to Fold, we use CAS sometimes, but we generally use CAF and P&A and private financing. Is generally looking at differential rents, and then for the CAS, obviously a fixed rent and maybe an allowance towards it. That's definitely generally the funding we use. We provide communal spaces in all of our schemes, so a place where people can, all the residents living there can generally decide what goes on in that communal space, and it provides for that informal interaction with people and addresses those isolation. And we are able to access a grant to support those communal spaces on our schemes. So if you want any more detail around that, Aisling, if you want to link in with
Oh, great. Absolutely. That'd be great. Thank you. That's great.
No problem.
Thank you.
Aisling, thank you very much. Thank you.
Thank you.
And I see we have Anne lined up. Anne, are you?
Hi, how are you?
Can you hear us?
Yeah, I can.
Hi,
hear
Anne.
you.
Yes, perfectly. Thank you, Anne.
Okay. It was just in relation, as you're probably aware, you know, that the way the funding is coming down for the housing with older persons, you know, there isn't a defined stream of funding to provide the social care that's needed within those houses. A lot of the new developments through the voluntary kind of housing associations, the councils used to have the old-fashioned warden on site who would help and promote, and there doesn't seem to be that funding available to the agencies to do that. And there's a gap there between when they come to us in the HSE to look for support, that we don't have that, I suppose, funding to provide that support. You know, is there a discussion going on at a higher level between the departments about how we can fund and support our increasing number of older persons in a preventative way, you know, to prevent them needing a higher level of care in the future?
Gina, I presume it's me that you want to take that question?
Please, yeah.
Sorry, Karen, yes, if you could please take that question. Thank you.
Okay, thanks, Anne, for your question. I suppose maybe to address kind of the middle of what you said first, is there a conversation going on about this? And yes, absolutely, very definitely there is. The conversation, I suppose, is not as easy as all that. I mean, there's a continuum of care that you need to think about. So when we talk about supported housing, that's a kind of a variety of things, and it goes, we kind of have a spectrum where you start from an old person who's perfectly well and doesn't need anything. We go to someone who just needs housing adaptation grants, which we can do. We need someone who needs a home care service, which I think the Department of Health and HSE are doing a very good job of trying to provide those. Then we go to home care and repair. Then we go to more suitable homes. Then we go to supported housing. Then we go to supported housing with high supports, and then a nursing home potentially. So what we're looking at the minute is probably that middle bit, the supported housing. Again, St. Michael's is a demonstrator project in that respect. That particular housing development has come about beginning with cooperation between the Department of Health and Department of Housing, DCC, and all of the AHB circle and alone being in place. Beginning with the theory that if we all get together at the start and we agree what funding will go in, and then we see how that pans out. Now, what's going to happen is the housing agency are going to do an evaluation of that project as it keeps going. And what we're going to learn out of that for ourselves in our Department of Housing is the costs involved, which we really do need to know. And we're seeing a lot about that as we do. Department of Health are going to learn what are the costs involved for them and how would they put together a package going forward. As you know, they do provide a lot of funding in various different areas for older people and housing. I'm not saying they don't already, but how can we get to maybe a stage where we could actually say, this is actually going to be a budget for these types of housing developments going forward. Yeah, we need to be able to tell them how many are we likely to be able to do, how many do we want to do, what's the appetite, and what AHBs might be on board, and how would we fund that. So that's kind of all work that's in progress. It's kind of a key area for the implementation group to address going forward. I don't know that it will get finished by the time the implementation group finishes, but it's a key message that we have, will be putting across, I suppose, that work will have to continue afterwards. I think what we're seeing out of COVID is an inclination to address it further, that we do need to do this. And I know the Housing Institute are going to publish during this month, possibly toward the end of the month, a paper on why, in fact, it makes economic sense as well as social sense to fund this type of development, and to put more into this as opposed to maybe nursing homes going forward, although we probably will continue to need both types of care. There's a very definite both economic and social argument for the type of supported care that we're talking about here today. I don't think that that's being ignored in any sense. We just need to know the actual technical size of the problem, and then at the technical size of the finances required to address it. But yeah, I think everybody's on the same page at this point, which is a move on, I think, in policy terms. And now we're down to the brass tacks of how we're going to do it. Does that answer the question?
It does. I suppose it's just, being quite an impatient person in many ways, just working in the HSE on the ground at the moment. And some of my colleagues on this will know very well that I'm looking for funding, through my own line management and seeking kind of approval for funding to support a number of different housing projects at this moment, where I can see the result in the lack of a warden being on site anymore through houses that used to be through the DCC, who would help negotiate and signpost a way for older persons. The change that has happened within our own home help services to a very much, personal care basis, with the reduction in kind of the support in terms of housework, etc., that used to be done, that were preventative services in many ways. There's been a huge redirection of funding into personal care because there is that number of older persons living longer. Now, I've been involved with the project in Chicor since the very start, so I'm well aware about the funding and kind of the applications that we've done in relation to that. But I suppose it's just, I think that conversation needs to happen quicker than it is to help support, issues like the couple of hundred older people now living in older persons accommodation who don't have any support, And things like the housing adaptations are taking over a year for funding to come through. It's still very slow,
Yeah, just in relation to that, we have recently, I suppose, revised the process for that, and I hope for people on the ground that it is a lot clearer and a lot easier to manoeuvre or make your way through from now on. I think the unit and department who deals with it have done some good work on trying to get that process to be a lot smoother and to work better. So I hope people are finding that.
Maybe Caroline, you could share that with through the ICSH so that members could access that. And I suppose in addition, that question, and thank you very much, Anne, for your question, and it sort of answers some of the other questions coming in about more rural settings and how we support our older people living in those rural settings, whereby we can provide the accommodation, but it's that additional support, just like Anne, you're experiencing in urban environments, the exact same thing, within the rural settings. We have another question from Tig McFadden. Are you on, who's hopefully joining us now online, or I can read his okay out if
Tina, he doesn't have a mic or a camera, so
okay, I'm more than happy to address his question to the panel. And basically his questions is directed towards yourself as well, Caroline, and it's about how do we facilitate older people in their own homes with care needs, accessing housing with care. And these are mostly for people who don't have access to social housing, who are homeowners, and how can we facilitate their needs through the various models that we're now delivering?
Yeah, that's actually something we've definitely been looking at in my own subgroup of the implementation group. One of the things we looked at is what was actually happening on the ground in relation to this for people in private. And we've gone around and looked at the various local authorities, and some local authorities, you will know, have had bespoke solutions for this. Small AHBs have developed housing and you have a mix of social housing applicants, and you also have private people going in, particularly where there's a level of CAS funding you can access whereby there is an opportunity to nominate other people just rather than just social housing occupants. And also there have been some housing developments where people have either, I suppose, made a financial contribution. They're called financial contribution schemes at local authority level, or there have been some schemes where people have been allowed to give their house or it's bought by the local authority, and in return they are added to the list. What we're looking at now is what kind of scheme would we have going forward in relation to this. Again, we're using Glen St. Michael's as a pilot. What's the optimum mix in a housing development? How much social, because the state obviously has a burden of care to people on the social housing list. Their needs are higher, just by the fact that on social housing list, we know that. Their needs are higher and we need to address those first. However, we need to have an appropriate mix. The HSE then obviously have to think about those who need the supported care, and they need to nominate as well. So the nomination rights in respect of any given development, they're complex, but we do intend to try to include some private on it. But it's not just about what the state will produce. And in that respect, we have to encourage private providers to come along, because a lot of those people who live in their private homes have, they may not be cash rich, but they are asset rich. And where they can contribute to their own care, they should do so. And because the state has a massive overburden of asks in the social care sector, and we need to try and direct our resources where possible. So if there are private providers who can come along and offer that kind of care, we need to encourage that type of development so that people who can afford it can access it appropriately. Then we also need to encourage the cooperative systems of care that are occurring perhaps in the AHB sector, and also that we see in the co-housing sector across Europe, which is not co-housing, it is actually more like cooperative living, where they have brought forward interesting systems such as community land trusts to provide for their own care. So where people are minded to get together and push things forward, how can we make it easier from a legal and I suppose from a land ask point of view for the state to support that, not necessarily to build it for them, but to allow them the facility to do it for themselves. And then communities can get together on that. So I suppose there's a mix of solutions to that particular question, from the ones that we can more easily control ourselves, which is those we directly fund through CAS or through CAF. We're certainly open to the idea that we certainly could do with a mix of tenures in there. So that's something we'll actively be prepared.
And I think this is linking into some of the other sessions we'd had around funding and development and looking, you know, at those sort of mixed tenure models, maybe for not necessarily shared ownership, but perhaps some form of sub-market rent or mid-market rent that, you know, we can have mixed tenure across the needs groups, you know, to include older people and not just for general or for starter homes. Kathy, I think you're on the line now with a question for Caroline. Hello, hello, we can't hear you. Sorry, Kathy, your microphone, we can't hear you. If you're using a headpiece, perhaps you just speak directly to the...
It's so great to have the context. Thanks so much for your time today. I know you're up the wall, so I'm really delighted to have the contact, and I look forward to working with you in this
Sorry,
regard.
I think we've a cross line somewhere here. Thanks
so much for the call. Yeah.
Sorry about this, folks. The joys of tech. We have another question in here that's from Rushad Nariman, and his question is to Aoife, and he's asking about how that private finance, how can they get involved with private finance and helping you develop your model within Clann? Do you need funding from alternative sources, or you?
Yeah, so we access through the Housing Finance Agency, and that's how we access the private finance, and it certainly allows us to go, I suppose, bigger in terms of scale. And it's definitely something worth looking at and linking into. I saw another question on there from a more rural, smaller AHB, and financing is definitely a challenge for these schemes. So that's what we're accessing at the moment. I hope that answers it. I think that's Kathy there for you, Tina, now.
Kathy, sorry, but we just engaged with your call, Kathy. So your caller was live there on across the globe, Boston, Massachusetts.
I'm so sorry. I'm so sorry. Well, now you've learned about PA service provision, which excels up in the north of Ireland. I'm so sorry about that.
You're fine. You're fine.
But I didn't want to lose that because I'm PA services is a hot topic in Ireland, as I'm sure across the world. And when you get the call from the service coordinator, you want to take the call. So I'm so sorry.
You're fine, Kathy.
Now you've got a flavour of the context of my work. There you go. I'm very excited for this webinar, and DFI is involved in housing in Ireland at the local level of housing and disability steering groups and nationally. But I suppose we're a bit jealous of the great work that happens in the context of older persons and in the context of mental health coordinators, because like different rooms in the house, they seem to be getting more of the toys. Now, I know that's not true, but that's just the optics of it when you're on the outside in the disability sector knocking on the door. Now, we've got great advocates in the system of disability, and that starts and ends with Claire Feeney. I bow to the altar of Claire Feeney. She's a great worker at the departmental level and influencing change. So things are changing and moving, but I suppose I often at a local level, we get stuck at the CAS level of applications and the bureaucracy around that. So more and more in Ireland, you see there's an age-friendly alliance housing coordinator. There's now a disability, I'm not sure of their title, coordinator in Wicklow. So I'm just wondering at a national level, is there this move to support an identified role at a more local level to facilitate that conversation of overcoming the bureaucracy of CAS applications to support the disability specific need of housing developments? I suppose that's a bit of a broad question, but if you could take one element to consider.
Okay, I'll take that one. So, Kathy, thanks for the question. Yeah, you've gone over a little bit there now. So actually, I'm going to approach from the start, which is interesting. When I saw your question originally, I was going, God, I would have said that the older person's policy was built on the disability policy. That's what I would have said, most definitely. I would have said they were coming off the back of what you had done in that sector. Certainly in terms of the national strategy for housing for people with a disability, which definitely, predates this strategy by a number of years, and which is due for renewal next year. It actually paved the way for this particular policy statement. So I would say in terms of policy, disability is actually running ahead. And in terms of the international policy, you're running ahead as well, I would think. Although older people will catch up with you just by dint of the interest in it at this point.
Yeah.
In terms of the organisations, also the organisations tend to be very sophisticated in the disability area. What I find is because there's less in the older people area, it tends to be more coherent, which is just one of those things. There's actually just so many actors in the disability area that we tend to get, I suppose, a more unified voice from the older people's area. There's also more agreement about what we need to do, and it's possibly an easier area to progress in some ways because there's less disagreement about it, which is interesting in its own right. We'll come back to looking at this, I suppose, as we move through making the new strategy next year, which is going to be interesting to see how we move this on. We'll take some learnings from what's going on here in terms of design, but you already have a lot of design done in your area. There's a lot of good guides out there from the housing agency in this respect. I would say actually, yeah, you're still actually a little bit ahead. So I wouldn't feel like you're behind at all. I'd say you're a bit ahead. Just in this particular forum, this is what we're interested in. What I think is that there's so many linkages between older people and the disability sector because there is an interlinking between the two. I'm still keen to keep the separation because it's not the same, but there is definitely similarities and there's principles that we should be applying to both. So that's definitely going to be the way. In terms of AFI, which I think you're referencing, Age Friendly Ireland, sometimes I think that that's powered by personality alone in many respects, because there's just some really fabulous people working there and they get great support from their local authority sector. I won't speak for them, to be honest, because that is the local authority sector. It's for them to maybe to say what they think that they need to do for disability. I think the housing with the disability steering groups that we've put in place in the last few years, which is Claire Feeney's great work there, have really been important in that respect. And that's been a development that the older people haven't had. I think they're doing work to identify what you need there. And I'd be expecting them to push back up to us as we're doing the next strategy, what they think needs to be in place in the local authority sector. So it's going to be interesting to see what comes out of that. But I'll leave it to them maybe to address as part of the work that we're going to do next year what we do need, but I'll be expecting maybe all of your thoughts from DFI to be coming through that as well. We'll see what happens.
I appreciate the feedback. Yeah.
Kathy, thank you very much for your question. I hope that was of help. I think just really time is against us now, and I would just like to draw things to a conclusion. I think today's session has been very, very useful, covering areas of policy, design, and from a practitioner's perspective as well, and our end user qualities, accommodation. And basically tomorrow there's a big concentration tomorrow on financing and hopefully that, and policy, and hopefully that will address a lot of the issues that we have around the models that we have, that we are trying now to apply all the design principles. We have all the strategies in place, and we need to pull all those strands together with regarding to get the appropriate supports in place and funding to support those supports. But I mean, today it's been a pleasure to chair this session. I'm sorry I wasn't on the other side of the table because to participate, it's been great to hear from you all, in particular Patricia, and all of the learning that you can bring, and just to all the listeners today, that they can engage with all of that research through your website, and also any information that the Irish Council will put it up in theirs. And today's session's being recorded, so if anyone wants to go back in that. And so thank you so much, Patricia. It's been very, very insightful and useful. And to Caroline, from a policy perspective, I know this is an area that you're working on and an area that will be expanded, and who, last year when we talked about these various policies and strategies, we didn't know that COVID was on our doorstep, and that's added a totally new dimension and probably enable us all to sharpen our pencil a bit and to get quick answers to a lot of the problems we're encountering. And to Aoife, thank you very much from your perspective as a practitioner and a national housing provider for accommodation for older people, and good luck in that role. And it's much needed, and an area very close to my heart as well. And just really to wrap it up, and thank all of our participants today. We've had quite a number on there and lots of questions. Some of them, we didn't get to all of them, but we would, anyone who has any other questions, please send them directly through to the Irish Council for Social Housing, and we will address them or pass them on to the individual panellists. Just thank you very much, everyone. Well done.
Thank you so much.
Thank you.